Good morning and welcome on the AM News. Now, government says it is exploring ways of bringing in more COVID-19 vaccination doses as it reveals the second jab may take place in May. Currently, the Health Ministry is in talks with Johnson & Johnson as well as the COVAX platform to bring in more of the AstraZeneca vaccines, but it's unlikely to meet the 6-week interval to administer the second dose. Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, during a media briefing on Sunday, asked Ghanaians to remain calm as the first jab provides about 76% protection for 90 days, giving government ample time to procure the second jab.
Based on some of the WHO recommendations how to deploy AstraZeneca, the recommendation is that it has to be the dosage of between 8 to 12 weeks interval doses. That is, as far as vaccination is concerned, what we have most important is the minimum time within which a second shot or booster dose can be given. If you do it before that minimum date, you will not get any benefit. But sometimes the longer you wait, it still doesn't matter that you can still have your second shot and get your booster dose build up. The WHO have done a lot of studies and has also shown that number one is that if you give it before 4 weeks or before 2 weeks, there's virtually no benefit. But between 8 and 12 weeks is the best time to give. Even then, you would have lost some percentage of your antibodies. It's still effective enough to protect you. What is the efficacy of one dose? According to the studies that have been done globally and around, it protects you about 76% protection for over about 90 days, which coincide with the 12 weeks we are talking about. But that's not to say second dose is not important. And so, given the vaccine availability, that is why we are now trying to shift it to the 12 weeks. But as vaccines are made available, like I said, the earliest is the 8 weeks, and that you'll be giving your vaccination. There are significant efforts being made, and we have some assurance from COVAX that by May we'll get vaccination, and if we get our vaccine in May, we'll be able to do our second doses and as a service, you are more concerned with having more people with the first dose.
Patrick Kumabwaji is Director General of the Ghana Health Service.